Good evening, Chief Guest, Dr. Palita Mahipala, Secretary of Health, Guest of Honor, Dr. Mangala Dissanayaka, Senior Consultant Physician, Dr. Asila Gunawardena, Director General of Health Services, Patron of the Sri Lanka College of Obstetricians and Gynaecologists, Professor Indraji Amarasinghe, past President of Sri Lanka College of Obstetricians and Gynaecology, Dr. Kanishka Karuratne, Secretary of the College, Dr. Mangala Dissanayaka, past Presidents, Council members, and members of SSCOG and Ladies Forum, officials from Ministry of Health, distinguished guests. The song you just heard is dedicated to all the mothers and my teachers at Faculty of Medicine, Colombo, simply because this song was penned by late Professor Carlo Fonseca. And he taught us the first medical term in our career, Padartha, matter. I think my batchmates know this better than me. So ladies and gentlemen, I'm privileged and honored to stand here as the 38th President of the Sri Lanka College of Obstetricians and Gynaecologists. This is a great achievement for me personally. I'm grateful to the membership for placing the trust in me and providing the mandate to elect me. I cherish every moment of my long journey with this esteemed college. SLCG born as association in 1958 with a handful of members and today has grown to become a sizable force, making a significant contribution to the society and women. I also want to pay a tribute to all past presidents and the members of the SSCOG for their contribution during this long journey. I have been a member of the college for 23 years and represent the council continuously for 12 years. During this time, I'm privileged to serve in the capacity of secretary, chairman of academic activities, editor, and many other posts. Today, I humbly stand before you as the president of SLCOG, committed to uphold the values we believe in. Enriching women's health is an unfinished agenda. I believe it can be converted to achievable goal through a process of learning lessons from history, by developing new visions with innovative ideas, and by maximizing resources. My address tonight is on quality healthcare through standards in training and service delivery, a right of all women. Quality healthcare has to be effective and evidence-based and safe, and we should always respect the individual's preferences and values. Health problems during the life cycle are different and demand different intervention. Therefore, challenges in front of us are enormous and complex. For example, infancy, you may see low birth weight, birth defects, nutritional deficiencies, and adolescents, you see teenage pregnancies, abortion, STI, malnutrition, and child abuse. And when it comes to the reproductive years, you have unplanned pregnancies, STI, abortions, and pregnancy complication. And post-reproductive age, you have all the non-communicable diseases, cancers, osteoporosis, and other estrogen deficiencies. And all the women and children have lifetime health problems like occupational and environment health, such gender violence, and psychological problems. So the life course model shows the intervention in early life cycle has more beneficial effect on future health. Intervention like screening in adulthood have limited and beneficial value. Women's health depend on many factors, including biological, social, and cultural, and nutritional, and healthcare, provided from the intrauterine life to the old age. Importantly, some are modifiable. We all know starvation in the intrauterine life has implication not only girls' health during childhood, but also long-term impact on the future of non-communicable diseases, which usually manifest in later age or after menopause. Spending and caring women's health and education is an investment for the country, and their contribution to the economy is huge. The clinical governance process is accountable for continuous improvement of quality health services and ensure high quality of health care. Clinical governance process include many vital components and need money and resources to activate all. The health budget in Sri Lanka is 4.1 of GDP when compared to the highest 16% in USA and the lowest 2% in South Sudan. In this backdrop, we need to identify and prioritize health services to extract maximum benefit from minimal budget. We need to find simple standards which can be used with the existing facilities without any additional cost to reduce the maternal and neonatal mobility and mortality. Standards are specific measurable targets which reflect the care of health services and healthcare profession should provide in order to be effective and safe to the patient. There are training, professional, and quality services standards, but fundamentally overlaps. Quality standards which are more interested are formalized by using national or accepted international guidelines. Standard plays an important role in guiding the delivery of appropriate care and reducing unwarranted variation. Unwarranted variation in care can occur when there are overuse of care, where the benefit of treatment or procedure clearly outweighs any potential harm for its use, but it is not used. Overuse of care when treatment or procedures is widely used, but the evidence of benefits are limited or missing. Misuse of care when the care provided to a person is not based on the values and preferences, and the risk and benefit of alternative treatment have not been fully explained to them. Standards are for everyone. For example, patient knows exactly what she can expect in the labor room, whether she will get epidural, internox, or opioid injections. So the health professional can counsel pros and cons of various methods and discuss alternative therapy. On the other hand, health planners can support and monitor the improvement of the hospital where standards are applicable. In Sri Lanka, domiciliary and field clinics contribute to good health indicators, with antenatal coverage of 99% and postpartum care coverage is over 75%. Even though quantitative coverage is high, there are specific gaps in the quality of services provided at the grassroots level. It is high time to look for new standards in the preventive sector as well. I just want to quote few audits done at field level. The antenatal care provided and its quality in field clinics in Gampa district has shown that physical examination was substandard in all clinics, and simplicity of unlight charts has not been maintained in most of the cases. When you consider the Sri Lankan public health midwives' knowledge on maternal mental health disorders, major deficiencies in basic knowledge in identify and initial management of maternal mental disorders has been revealed. Knowledge, attitude, and practice of public health midwives on adolescent and youth-friendly health services and their role in Gampa district shown that public health midwives' perception of their role on this subject was unsatisfactory. And training in Sri Lanka public health midwives on intimate partner violence, which was done in Kandy, and pre and post test, post intervention has shown that once they educate and train, they can deliver a good service to the IPF sufferers. We can be happy that all deliveries occur in hospitals, including private hospitals. Maternal death is a traumatic experience to the family as well as to the health staff who look after the patients. It is important to highlight that more than 60% of the maternal deaths were preventable. For many years, indirect deaths due to respiratory and cardiac disease were the main reason for higher maternal mortality ratio. Unfortunately, in 2023, we encounter more deaths due to bleeding and postpartum hemorrhage, which accounts for nearly 20% of all maternal deaths. Most of the audits done in the tertiary hospital on partogram have shown poor documentation and substandard care. Partogram is a vital tool to identify complication in labor in timely manner and intervene. Prolonged and obstructed labor are the leading causes of newborn morbidity and mortality all over the world. In summary, having standards in partogram results in shorter labors and better maternal and fetal outcome. Confidential inquiries reveal that 9 pregnant women develop severe maternal morbidity for every maternal death. Meo's chart tracks physiological parameters and detect evolving morbidity early with deranged parameters. The primary purpose of Meo's chart is to prevent delays in intervention or transfer of critically ill patient. Meo's chart has been used in 80 to 90% of women after normal vaginal delivery, but unfortunately, nothing was used after cesarean section. And cesarean section was monitored by using only routine observational charts. Most of the Western countries have identified clinical standards in obstetrics and gynecology. Ministry of Health, Family Health Bureau, and SSCG prepared document on standards in maternity care in 2015 under the guidance of Dr. Palitha Mahipala during his tenure as Director of Health Services. And I had opportunity to participate as a stakeholder. Here the training and professional standards have not been addressed, and standards are very broad and complex. So we need to identify standards which are very simple and can be applicable in our setup. The National Strategic Plan targets SG goals in 2030. It seems to be an uphill task to reduce the maternal mortality rate ratio to less than 10 in 2030, unless we have identified good standards in training and quality. Some of the objectives are already fulfilled, like partogram. We have almost reached 100%, but there's a big question mark over the quality of care. Third, delay and substandard care in hospitals has to be addressed by the introduction of clinical governance with accountability and establishing an effective communication system within the hospital. As members of the college, we have first-hand experience working in developed countries which function not as an individual professional, but as a system, which are driven by principles of clinical governance. This system functions in a non-blame environment. The deficiencies is identified not as individual, but as a systemic failure. Standards identify and set clear quality targets. Once the standards are identified, audits will reveal the gap between standards and actual performance. Improvement and intervention in the form of training and service delivery will be able to bridge the gap between actual quality and the required quality. So this depiction shows how to establish a standard setting activity in Sri Lanka. So the Family Health Bureau, Ministry of Health, and SLCOG and other stakeholders can have identified clear standards of service. And professional self-regulation comes with the intervention of Sri Lanka Medical Council and the CME activities from the other sources, which gives a dependable, local delivery. And we need a Directorate of Healthcare Quality and Safety, Ministry of Health, to monitor the progress of the standards and make intervention when it is necessary. Way forward, it's important to implement the training and professional standards in our setup. Training mid-level cadre is important because more than 80% of the cesarean section are performed by senior house officers. SHO should undergo training module within 6 months before undertaking the post. And training will be conducted in same hospital and regional training centers with the same resources identified by the Ministry of Health. This was identified in the National Strategic Plan, which I mentioned earlier. And senior house officers should maintain logbook and CMO points to be awarded. And once they are accredited to perform clearly identified procedures and surgeries. It's important to revalidate them after 2 to 3 years. And SLCOG is in the process of preparing training manual and curriculum, and we are happy to take over until the ministries will do the needful. Midwifery curriculum and training should be reorganized. It's important to learn the maintenance of CTG, partogram, Meo's chart, and identification of risk factors and early warning signs, and emergency obstetric care training. And training at regional centers with existing facilities can be used without any additional cost. Revalidation every 2 years is important, and field staff should be working hospital setup in rotation. SHO will maintain an online platform for CME activities to help the Ministry of Health in near future. In addition, present labor ward staff should undergo in-service training in emergency obstetrics care within 6 months and should be certified. Maintaining a logbook should be encouraged. And revalidation every 2 years is a must. So it's important to implement the quality and service standards in hospitals. And it is important to conduct audits to identify gaps in the system. We can take a very small topic like types of analgesia available in labor room and what percentage receives adequate analgesia and patient satisfaction. Suturing episiotomy with adequate analgesia within 30 minutes of delivery, and what percentage of mother receive max sulfate, and the time gap between fits and the loading dose. Meo's chart. In 2023, 20% of maternal deaths were due to bleeding. Most of the deaths were following cesarean section, and they are detected very late. According to predictions, cesarean section rate will reach 50% by 2025. Meo's chart has high sensitivity and specificity over 85% and negative predictive value of 95%. So monitoring with Meo's chart results in early ICU admission, but not necessarily increase the ICU admission. We are talking about the obstetric indication and standards. What about the gynecology? We always forget this gynecology part because there are no standards in gynecology available in Sri Lanka. There are important topics like recurrent abortion, early pregnancy loss, contraception for high-risk patients, and standards in colposcopy. So we need to identify the standards, especially standards in colposcopy is important because some of the patients are waiting for a longer period to get access to the colposcopy clinics. So example, low-grade cytology should be in colposcopic clinic within 8 weeks and high-grade cytology within 4 weeks. If cervical cancer suspect, the patient must see within 2 weeks. There are few simple standards which we can employ in our setup. And all colposcopists should have formal training or accreditation to practice colposcopy. And there should be a name head to monitor the quality standards. And all trainees should attend the colposcopic clinics according to their portfolios. Sri Lanka is facing the worst economic crisis in its independence, and more than 30% of the families have been pushed below the poverty line. High inflation rate and high cost of living and high transport costs have a negative effect on health services, especially affect the women for some obvious reason. And headline inflation is more on food and transport. As a result, priorities have been changed, and getting a basic diet is the number one priority on the list. Health may not be the priority in the future for most of the deprived families. To make things worse, the female labor force has dropped by 3%, and almost 7% of the women in private sector have lost their jobs. In this backdrop, infringements to the health services will have catastrophic results. Large research in rural areas has shown that the out-of-pocket expenditure has increased for medicine and for investigation, even though for pregnant women who use only the government facilities. So migration of health staff is a major concern and a burden to the health structure. It is sad to note in 2023, we lost at least 3 mothers due to non-availability of consultant in some designated places. It is essential to widen the food program and social network for provision of nutrition for pregnant and breastfeeding women. Domiciliary visits need to be increased to identify women who are at risk of developing complication. Provision of iron supplementation is important and can be done during home visit. Prior arrangements for the transport in emergency situation is vital to prevent second delay. This year we are looking forward to address some hidden issues by preparing SLCOG position statements on sexual and reproductive health for internally displaced people, because Sri Lanka is prone to constant natural disasters and providing reproductive services is in our agenda. We face similar problems during the war, and SLCOG provides services with utmost dedication. In addition, sexual and reproductive rights of disabled women and maternal suicides are important areas for us. Confidential inquiries into maternal deaths with the pilot project started in 2 provinces in July 2020, and we're hoping to start the national level in 2024. But having 2 groups of data make the final analysis difficult, and the dissemination at district level will be delayed. So I urge the ministry to implement the CMD process from this year onwards, so it will make the things easy to analyze the final report, and we should be able to disseminate the knowledge and facts to the district level as well. So changes are challenging. Challenges arise from professionals in the provision of services. So facing challenges head-on can bring a sense of satisfaction and fulfillment. With this, I come to the end of my speech. I would like to acknowledge few outstanding personalities who have helped me to climb this ladder in my career. Although they are numerous, it may be duty to show my gratitude to at least few. Dr. Zanula Vijay Sundar and Dr. Late M. Mubarak, which I did my internship. Professor Harsha Seniratne, Dr. Siri Randinia, Dr. Rohan Attotua, Professor Atul Karavachi, Professor Hemant Senanayaka, Professor Chandrika Vicharadne from the Professorial in Colombo, and Dr. Vidya Tilaka and Dr. Periya Perum and Dr. Ajit Fayandu, and the teaching staff at National University Hospital, Singapore. And I'm very grateful to the Dr. Rohan Attotua, Dr. Lakshman Senanayaka, Dr. MDP Gunratne, Dr. Anand Ranatunga, Dr. Gamini Pera, Dr. UDP Ratnasiri, and Professor Natla and all. I had to work with them during their tenure as the President of the SLCOG. My special appreciation to Dr. Hemant Pera and Dr. Karunaratne, who helped me during my career and I had the opportunity to work with him and during from 2011 onwards. So thank you very much, sir. I like to remember my late parents, brother and three sisters, and in-laws with immense gratitude for guiding me along the correct path and providing me with the great strength and courage at every stage of my life. I owe a special thanks to my wife Shiromali for supporting me at difficult times, and my two sons Randika, Dilwan for not complaining about my absence. Again, I like to thank Dr. Akmi Manas, Arsha Fusha, Darshan and Ruwan, Achinte, who are my colleagues, and the members of the Ladies Forum, and the Harshin and the SOG staff for arranging all the difficult things for me and making this a successful event. Thank you very much and good night.